Okay, at this point, if anyone has any questions, we have about, I don't know, 5 minutes. If you have any questions for the presentations, you can ask those or anything about the cases that were presented.
Andrew Cordover. At Andrew's Sports Medicine, I have a fair amount of professional and college athletes in my practice. One of the banes of my existence, and I'm curious to hear how each of you would counsel a patient for an MRI that was probably not indicated, was done. Probably patient has a component of diffuse underlying congenital stenosis with a superimposed disc herniation 4.556, canal diameter down to less than 8 millimeters, no cord signal change, negative exam. What do you tell them?
Yeah, I can start. I mean, I think that is that's what makes return to play so challenging. And I think most of those decisions are going to be based on kind of what the risk tolerance is, both on the side of the athlete, the side of the team, the side of the agent, the side of the family. I think you have to counsel them, and it's a shared decision. For me, the canal diameter that you're describing, if it's a collision sport, I'm saying you can't go back, especially at 2 levels. But if it's a sport that comes with a lower level of collision intensity, such like baseball or something, I would be okay with them going back.
Any other comments from the panel?
What about skiing? Because I struggle with skiing because, you know, it's not a collision sport, but every so often there's a really big collision. How do you handle skiing in those circumstances?
Yeah, I mean, for me, I'm okay with it. It just depends what kind of skiing they're doing. I mean, are you talking about like a regular person skiing or an athlete skiing?
I don't know.
Yeah, I get a regular person skiing. I would just counsel them to, you know, you just educate them on what they've got. I think for the most part, at least in my practice, most patients, once we describe the surgery to them and sort of getting rid of the risk, choose to have surgery done in a scenario that you've painted with an 8 millimeter canal. You know, if there's CSF around the cord, I don't have that conversation with them. But if there's no CSF and they've got a canal diameter that's small, you know, I don't use you could go paralyzed, that kind of, but, you know, but I counsel them that if you have an injury, you're at greater risk. And then when we talk about the surgical options and sort of the recovery kinetics of surgery for something like this, especially in an anterior cervical procedure or a laminoplasty, most patients that I take care of will choose to say, you know what, I understand that I'm going to have surgery for this.
So back to skiing, it's collision versus contact sport, and totally different animals to me. And pro skiing is collision, not contact. And for my single levels, I've had patients that the NFL or other organizations will not let them return, so I have done single level cervical fusions and returned them to play without any issue. It's the multi-levels that become even more challenging. Thanks.